So why does my shoulder hurt? It's a common question I hear, and a lot of people deal with shoulder pain for different reasons, different ways that it happens, and for a lot of people, it really doesn't even take much, and all of a sudden start having shoulder issues. So it's a great question to have. Why does my shoulder hurt? Does your shoulder hurt more at night? Are you having trouble sleeping? Do you find positions that are very uncomfortable that you can't get into a good position because the shoulder hurts too much? You don't know why it's happening at night more than any other time of the day. Do you know why it started? A lot of people don't even know when or why their shoulder started hurting them. And what impact is it having? So, shoulders are so complex that a lot of times people don't realize that their shoulder is a problem until all of a sudden they can't move it anymore. And reaching overhead to get into the cabinets or even putting clothing on now becomes a chore. So, for a lot of people, it's a developing issue that's happening that eventually gets to a point where now they recognize it. For some people, it's very obvious. They can just, injure their arm. They can land on it. They can fall on it. They can, throw something, lift something. They know that there was an injury point where it started the whole process. For other people, it's so subtle that they don't even know what happened. And I've had plenty of patients over the years where someone might have fallen or landed on their shoulder 6 months or a year ago, didn't even think about it, didn't have much issue with it at the time. And now, about a year later, they're saying, "Oh, my shoulder is really hurting. I don't remember doing anything." And then we kind of go back to the beginning and realize, you probably had an issue when you landed on that shoulder 6 months or a year ago. You didn't really recognize any limits or problems with it until now. And that's a common thing. So a lot of people just kind of deal with a little bit of an ailment. What I find is when it comes to shoulders, you know, there are very there's a lot of function that goes on with their upper bodies. And whether it's your dominant or non-dominant arm, it doesn't really matter as much, but it does have a bigger impact when it is definitely your dominant arm that's affected. So what happens a lot of times with the shoulder is there's an inflammation that occurs in there. And then once the inflammation starts to get going, then that's where you have sometimes pain. That's where sometimes you'll have a loss of mobility, a loss of strength, and now it's all leading to a loss of function. So if I'm somebody who, normal motion, I can get overhead like this and reach and have no problem getting where I need to go. And now all of a sudden, my motion is now from here is now here. But I don't really notice it because I don't really have to get this far up all the time when I'm doing daily activities. Here I do, but now all of a sudden my motion goes from here to here, and now I start noticing things. So reaching for things, grabbing things, that's what I find is now more difficult. And that's generally what most people will find when it comes to shoulder pain. So what is it that's actually causing shoulder pain? Well, there's a whole lot of different factors. And again, I just want to talk about a few things that may be causing your shoulder pain. As I mentioned, the shoulder is a very, very complex joint. There's lots of moving parts. It's very unstable by nature. So just to give you a few things here. So we have the shoulder complex here. This is your humerus, little anatomy lesson again. This is your scapula, the back shoulder blade. And then this is your clavicle from the front. So this is the front aspect of the shoulder. All these different red areas are where muscles are attaching to help provide stability. So as a general rule, the joint itself is not very stable. It's a very shallow socket with a ball that hinges on it, and it goes in every single direction you could possibly think about. So that's what makes the joint so complex, is the joint structure itself and then all the musculature that surrounds it. So by nature, it's not a very stable joint. So the stability comes from the ligaments that surround it and from all the muscles and tendons that surround it, as well as a whole capsule that helps provide more support with connective tissue structure. So that's what provides support for the shoulder. So as we move the shoulder, we have a lot of different moving parts that are working. So on this model, we have a bunch of different muscles that are connecting to this. So we have muscles across the back of the shoulder blade coming in and connecting to provide support across the front of the shoulder. And then from the front view, we have all these other muscles that are connected to the back of the shoulder blade and the scapula, and coming up and providing support in this way across the top. So in general, what happens is you're getting some type of inflammation that's going to occur in the shoulder joint itself. And most commonly, you're going to have the tendons that become irritated or inflamed. There's a couple different muscles. There's 4 muscles that make up the rotator cuff. And yes, it's a cuff. It's not a cup. It's not something else. It's not a rotor cuff. It's the rotator cuff. And those 4 muscles make up what stabilizes the shoulder joint. So you have a lot of different muscles that are engaged with the shoulder, but these four main muscles help provide most of the mobility for the shoulder and movement, as well as stability for deceleration when the arm is moving and every movement that the shoulder encompasses. So what happens is any one of these muscles can be inflamed, irritated, and it doesn't take much to do that. Once they get inflamed over here, you have bursa that sits underneath that can also get inflamed. So once you have one structure inflamed, you're generally going to have both structures because they're in intimate contact with one another. And then anything around here creates irritation. So now when you try to move that arm up, you're pinching into these areas a lot of times, causing more strain and more pressure that's creating more irritation, giving you the pain you're having. So a lot of times what you're going to have is the shoulder joint itself could be a problem with arthritis in the joint. You can have issues that can cause inflammation in the joint. But a lot of times you're going to have tendinitises, you're going to have tears of rotator cuff muscles, you're going to have imbalances that create a lot of the problem that people are dealing with. And because that shoulder is so complex, that's what I find is the biggest issue, is it's a balance issue between what muscles are firing and what muscles aren't. So all those muscles become very imbalanced, and now they can't work or activate properly at the proper timing. There's a lot of timing that goes on to the shoulder complex. And if the certain muscles aren't firing or working at the right time as the shoulder moves through its motions, then you're going to have other muscles that are going to compensate and take up for that slack. So when there's overuse on the muscle, that's what creates the inflammation. And the crazy part about what happens with the shoulder is overuse is not playing tennis for 30 years or doing an overhand sport or throwing. It doesn't always lead to that. A lot of times for people who are not athletes or not doing those activities, their overuse injury is now going to be daily life. Reaching in the cabinet, reaching in the refrigerator, putting clothing on, anything overhead. If they painted a room for the weekend and they were doing this constantly, that's an overuse injury. So what I find a lot of times with people is overuse isn't very much, but it's just the constant impact of those tendons and of those structures that create the inflammation. And then we keep doing it over and over again that creates a constant inflammation that now you're having pain, you're noticing a loss of function, loss of strength. So when it comes to the shoulder, the main structures that are going to get in the way is going to be arthritis of the joint, which can cause pain and inflammation. And again, anytime you have inflammation anywhere around the joint structure itself, it has the ability to create inflammation anywhere around the tendons and ligaments that are surrounding this joint, so that different movements are going to create pain as well. If you have a tendonitis in one of the muscles, that means every time you move the arm, you're pinching, causing more pain, causing more problem for the shoulder, and getting more pain and loss of motion and function and strength again. So arthritis is one major problem. There's also a piece of cartilage inside the cup of the socket of the scapula, and that's called the labrum. That can also tear, and when that tears, that's kind of a constant pain you're having as the humerus is moving throughout that joint. So that can cause another pain. Then you have the tendinitises that can occur with any one of those muscles, and most of the time it's going to be one or two of the four rotator cuff muscles are generally the ones that are a problem with a tendinitis. Also, biceps can also be a tendinitis issue that gives pain very similarly in the shoulder. And then you can have tears, and you can have tears that are very minor, that most people are going to have some tears and there's going to be no hassle or worry about it. They're going to live their lives without having anything to repair it. And then you can have a massive tear where it completely pulls off or almost pulls off the shoulder joint, and that becomes a major problem. And those are the ones that may require surgery. So they can do surgical repairs on the labrum. They can do surgical repairs on the ligaments if they're torn, to provide more security and anchor it to the joint and have better stability of that muscle working. Or they can also do a surgery that will repair or replace the socket and the joint itself. So a total joint replacement of the shoulder. So those are all the surgical repairs that go on. But there's a lot of people that live with shoulder pain and just kind of keep dealing with it. They don't want surgery. They don't want to deal with the hassle. And if that is the case, then they're trying to look for conservative approaches. Most of the time, the most conservative approach is going to be injections, cortisone injections, steroid injections into the shoulder to calm all the inflammation down. And then, of course, they're going to recommend therapy. So as a physical therapist, what our job is to do is to try to restore as much mobility of the shoulder and strength of the shoulder to, again, regain their function to use the arm again. And a lot of times we can be very, very successful with this, and it works very, very well. And people don't need any other treatment besides doing some therapy, working hard at it, and getting better. And other times they do need surgery and a surgical intervention. And when that's the case, that process just takes a little bit longer. They're usually in a sling for sometimes 6 weeks. And as they're using the sling, they are immobilized the whole time. So once we finally get the sling off, we now are dealing with a very weak and very tight joint that we need to work through. So the rehab on that can be very challenging.